Predictors for adverse life experiences of 3 to 5-year-old children. My name is Sophia Colon. I am a graduate student at George Mason University. Adverse childhood experiences, or ACEs, such as abuse, neglect, and household challenges, were first studied by the Centers for Disease Control and Prevention, the CDC, and Kaiser Permanente between 1995 and 1997. The study found associations between ACEs and the negative health outcomes such as chronic illnesses, depression, anxiety, and unhealthy behaviors. The CDC recommends a multi-sector effort to reduce and prevent ACEs to improve health outcomes across the lifespan. The purpose of this study is to examine the effects of a child's race, poverty level, gender, and the number of times children receive preventive services in the last 12 months on the number of adverse life experiences among 3 to 5-year-old children. We will perform an observational retrospective study using data collected from the 2011-2012 National Survey of Children's Health, which was conducted by the CDC and the National Center for Health Statistics. The NSCH included 95,000 children between the ages of 0 to 17, and its purpose was to measure children's health status, insurance coverage, parental health, and several other characteristics. The data we analyzed is a subset of this survey, which includes 15,910 children between the ages of 3 and 5 years old. Our variables are preventive health service, a continuous variable that describes the number of times a child was seen by a doctor, nurse, or healthcare provider for preventive medical care, such as physical exam or well-child checkup. Number adverse experience is a continuous variable which describes the number of adverse life experiences constructed and based on questions regarding the family's income, housing, the parent's marital status, whether the child witnessed or was a victim of violence, and similar questions. Child race ethnicity is a categorical variable that describes the child's race as either white or non-white. Poverty level is a categorical variable that describes the child's poverty level based on federal poverty guidelines. Low poverty level describes income that is equal to or greater than 200% of the federal poverty level guidelines. High poverty level describes income that is equal to or less than 199% of federal poverty guidelines. At the time of the survey, 2011-2012, the federal poverty guidelines for a household of 4 people was $22,350 and $23,050 respectively. Our hypothesis. The null hypothesis states that there is no significant difference in the mean number of adverse life experiences among 3 to 5-year-old children when examined by the effects of the child's race, poverty level, gender, and the number of times children receive preventive services in the last 12 months. The alternative hypothesis states there is a statistically significant difference in the mean number of adverse life experiences among 3 to 5-year-old children when examined by the effects of the child's race, poverty level, gender, and the number of times children receive preventive services in the last 12 months. Our significance level will be set to p-value of 0.05. Our descriptive statistics. So our sample includes 61.69% white and 38.31% non-white 3 to 5-year-old children. The sample is closely divided among gender, with 51.20% male and 48.80% female. We found that 62.30% of these children come from a low poverty level. At least half of the children, 50.80%, had one preventive visit in the past 12 months. There are some limitations to this study that we can observe. For example, the data set is cross-sectional, which does not allow an examination of these predictors on the outcome longitudinally. Over half, 60.62% of the observations did not have an adverse life experience. Some of the associations we can make start with our gender. We found that 22.19% of 3 to 5-year-old males and 21.92% of females had one adverse experience. For children in a high poverty level, 31.77% had one adverse experience compared to 16.16% children in a low poverty level. We find that 25.81% of non-white children had one adverse experience compared to 19.72% of white children. The association between preventive visits and the number of adverse experiences show that 44.74% of children that had one preventive visit in the past 12 months had one adverse experience. We also found that 62.60% of children in the sample did not have an adverse experience, which creates a limitation in this study. So our assessment, we find that the child's poverty level, race and ethnicity, and the number of preventive health services they have had within 12 months all have statistically significant differences in the number of adverse experiences. So we will perform multiple linear regression analysis to assess how these predictors impact the outcome. Our analysis. The fit of the regression model is significant because the F-test is 3 to 14136 equaling 521.40, and the p-value equals 0.000, which is less than our alpha at 0.05. The predictors, child's race, poverty level, and preventive health services, will be significant predictors on the number of adverse experiences. The adjusted R-squared value accounted for 9.96% of the variation on visits. We use the adjusted R-squared value because there are multiple variables. The normality of residuals assumptions deviate, which indicates violation of the normality assumption. So in other words, an increase in poverty level is significantly associated with the number of adverse experiences when controlling for the other variables, and an increase in preventive health services is significantly associated with the number of adverse experiences when controlling for the other variables. In conclusion, poverty level and preventive medical care are significant predictors on the number of adverse life experiences among 3 to 5-year-old children. Poverty is associated with unhealthy outcomes such as chronic, non-communicable diseases, communicable diseases, poor mental health, and poor reproductive outcomes. A healthcare provider's understanding of poverty's impact on their patients' health can help them better connect with their patients to provide quality care. Preventive medical care describes the number of times children receive preventive services in the last 12 months. Literature on the association of preventive medical care with adverse experiences is limited. The CDC recommends addressing exposure to ACEs by conducting screenings, followed by intervention services, further examination on how preventive services impact the number of adverse experiences is needed. Thank you.